Hello everyone, and welcome to another episode of the Wise Decision Maker Show, where we help you make the wisest and most profitable decisions. Today we'll talk about healthcare, specifically how large health systems like hospitals can make hybrid work effective and successful in healthcare settings. Now let's talk about first a study of productivity in hybrid work and revenue in hybrid work among 150 small healthcare providers. What they found was that productivity, according to the healthcare providers who were responding, 56% of them saw increased productivity, 31% saw no change, and only 13% reported a decrease in productivity. What about impact on revenue? That's another important question. 39% saw an increase in revenue, 51% saw no change, and 10% only reported decreased revenue. So here we clearly see that for small healthcare organizations, overall hybrid work is a very positive. We see increased productivity, increased revenue for many of them. So for the majority, we saw an increase in productivity. For some, under a third, there's no change. Only 13% reported decrease. And then for about 2/5, they saw an increase in revenue. 51% saw no change and 10% reported decrease. And of course, we all know what hybrid work does to retention and recruitment. It greatly increases them. So this combination is very promising for small healthcare organizations. But, what I've seen, and I've worked with a number of healthcare organizations, including large hospital chains, if small healthcare providers can make it work, of course large ones can. They have more resources, more capacity to make hybrid work effective. So here's some examples of what that takes. I've seen benefits for a number of large healthcare organizations like improved staff retention and recruitment, enhanced staff engagement, enhanced collaboration, better relationships, and reduced burnout. And this is separately from the increased productivity and improved revenue, which I've seen in a number of these settings. So many of them have increased productivity, many of them have increased revenue, and the vast majority of the rest have no clear impact on productivity or revenue, but all of these definitely have improved staff retention and recruitment, engagement, better relationships among staff, and reduced burnout. So, how do you maximize flexibility and space with hybrid work? How do you improve retention? How do you improve recruitment? How do you improve productivity while reducing costs? I'll tell you in a case study from Heather Sprague, who is the Chief Human Resource Officer at Adina Health Systems, which is a chain of hospitals in Southern Ohio, which highlights the benefits of hybrid work. So for example, let's talk about some departments. Adina's billing department allows staff to work between 6 a.m. and 6 p.m. as long as they get their 8 hours in, which is great because it gives them flexibility, it helps them retain these staff and helps the staff be more productive. Hybrid work also helps many organizations, including healthcare firms, optimize their office space. So Adina, for example, reduced the number of offices it devoted to support functions, to operations functions, and now it can provide more room for clinical services, whereas previously its plan was to invest in opening up more offices, obviously costing money for clinical services. Now they don't have to do that. They can expand their talent pool and leverage telehealth. So they were able to expand their talent pool by hiring from distant areas, from remote locations. Now, you might not know this, but Southern Ohio is not the most attractive place to live for most people. It's not close to large cities. And so people who want to live in a larger city like Columbus, where I live, or Cincinnati, which is, so Adina is in southeastern Ohio, and Cincinnati is in Adina is in so Cincinnati is in southwestern Ohio. So this is not very close to Adina in southeastern Ohio. And it can now recruit people from remote locations around the US, not simply from Ohio. So it's IT staff especially who are hard to find, but others it can recruit easily from around Ohio because they're working on a hybrid schedule. So if they need to come to the office for a couple of days a week, that's much easier if you're making that drive from Columbus for an hour and a half or from Cincinnati for an hour and a half twice a week rather than 5 days a week. Telehealth is something that they're using, and that's very good for behavioral health and counseling services. So such healthcare services, great use of telehealth. And the providers can easily work from home. Now, there have been some challenges with connection hurdles. So maintaining employee connection and engagement can be a challenge if you don't use the right strategies. So Adina employs technology platforms to do so, WebEx Teams and Workplace from Meta, which improve communication and recognition and collaboration across departments. So using the right technology is very valuable. You also want to measure engagement and have action plans to ensure engagement. So Adina has a frontline leaders program to manage and engage remote and hybrid staff. And Adina also conducts 2 surveys per year, a pulse survey and an engagement survey, which helps them measure staff engagement and have action plans based on previous results and current results to identify struggling departments and benchmarks against similar healthcare organizations. What about turnover concerns? So Sprague's HR team, Heather Sprague's HR team, works with other business units to examine turnover data or exit interviews to identify potential issues and concerns. And of course, they do find that hybrid work, remote work, help reduce turnover. So there's an openness to adjustments if there are issues that arise, with patient needs as the top priority. Now, there are some challenges for onboarding and training that you need to overcome. So for example, what you need to do if there's no in-office exposure for remote staff, it's really beneficial to have on-site attendance. And I've definitely worked with healthcare organizations to have on-site attendance for new staff orientation, to ensure they understand their job and roles and to plug them into the organizational culture and get them established with relationships there. So this organization enforces this policy, Adina, for specific activities regardless of employee location. So having in-office onboarding, very helpful. And you want to prioritize patient-centric care. Of course, any healthcare organization does, but what does this mean in the context of hybrid work? So if you're facing some challenges with remote work in some of your departments, what do you do? So if they have faced some challenges with case management, with the utilization review departments, so what they did is, because they couldn't solve them in the context of these people working remotely, they brought these team back on site to ensure that there's effective inpatient care and proper discharge planning and transition care, which they really had trouble doing when these folks worked remotely. So this is the benefits of on-site presence, which is obviously a challenge when some people from your staff work fully on-site and some work in a hybrid or fully remote modality, and you need to coordinate among them. In some cases, it might be best to bring people on-site if otherwise patient care will suffer. So that's why you need to adjust hybrid work based on patient-centric needs. Now, Heather Sprague says that hybrid work will definitely continue at Adina, and she found that a study on hybrid work bedside nursing with remote support for patients is an example of something that can be easily done and for clinical services. So it's very important to stay connected with those you serve, ensuring it works for both the staff and the patients. So you want to have regular check-ins on your hybrid work to confirm its effectiveness for all. And that means sometimes you want to adjust to bring some people on site and or more of the time, and sometimes you want to give people more flexibility depending on the situation. So Sprague believes that the role of HR leaders in healthcare hybrid work is to focus on organizational culture, ensure high employee engagement, partner with business units to make sure that any concerns and issues are addressed, and be open to checking and adjusting when things don't work. So that's how you maximize hybrid work benefits for healthcare. And Heather Sprague is just a case study of a number of organizations that I've worked with and that I've seen large healthcare providers offer hybrid work and remote work effectively. So hybrid work is a talent magnet, of course, for recruitment and retention, engagement, morale, and in fact, improving some productivity and revenue, but it comes with some challenges. And so you want to train people and have good policies to address these challenges. So have good technology platforms, train people on how to use them, standardize the use of them, have effective onboarding, conduct regular employee engagement surveys, be open to changing arrangements if patient care is at risk. And so this is a practice that fosters a culture of engagement, teamwork, and connection that helps employees, the organization, and of course, patients. All right, everyone. I hope you've enjoyed this episode of the Wise Decision Maker Show, and please make sure to subscribe wherever you checked out the show and leave a review. It helps others discover the show, and it helps us improve the show.